Guys, I have discussion D for you. D is the quiet erosion, 7 signs of iron deficiency adults keep calling stress or getting older. Okay, we're going to go through that this evening for D. So please join me. Please enjoy. Iron deficiency rarely announces itself. It doesn't arrive with dramatic collapse or a sudden crisis. It doesn't demand attention the way chest pain or fever does. Instead, it drifts quietly into the rhythms of daily life, reshaping energy, mood, and physical capacity in ways so subtle that most adults never recognize what's happening. They blame their jobs. They blame their sleep. They blame their age. They blame themselves. A culture that normalizes exhaustion, that glorifies endurance. Iron deficiency has become the perfect masquerader. Its earliest signs look exactly like the things adults are taught to push through. And because these symptoms whisper rather than shout, they often go unnoticed for months or years. This this is a story of those whispers, the 7 subtle signs of iron deficiency that adults mistake for stress or aging, and the deeper story of why we keep missing them. Fatigue that feels heavier than life. Fatigue is the background noise of adulthood, but iron deficiency fatigue is different, heavier, more stubborn, more passive. It is not, I am tired from a long week. It is, I woke up tired. I can't get my energy back. I feel like I'm dragging my body through the day. This happens because iron is the backbone of hemoglobin, and hemoglobin is the backbone of oxygen transport. When iron stores fall, oxygen delivery falters. The body compensates by slowing down. Adults rarely interpret this as a medical signal. They assume they are burnout, but not anemic. They push harder and the fatigue deepens. Headaches, dizziness, and brain fog. Stress is the earliest explanation for headaches. Dehydration is the second, but iron deficiency often produces a distinct neurological pattern. Tension like headaches, lightheadedness when standing, and a foggy, slowed quality of thinking. The brain is extinguishingly sensitive to oxygen. Even mild reductions change how people feel, think, and function. Adults chalk this up to multitasking, aging, or too much going on. Iron deficiency hides inside the noise of modern life. Feeling unusually cold, cold hands, cold feet, a chill that doesn't match the room. People blame themselves, blame the thermostat. They blame circulation. They blame winter. But iron deficiency reduces the body's ability to regulate temperature. Less oxygen means less heat. The cold is real, and it is physically psychological. A pale or off skin tone. Pallor is subtle. It is not dramatic. It is a quiet fading of color. Lips that look less pink. Nail beds that lose vibrancy. Inner eyelids that look washed out. Most adults attribute this to stress or poor sleep, but pillar the but pallor is one of the earliest visible signs of reduced hemoglobin. It is the body's way of signaling that oxygen delivery is compromised. Shortness of breath with mild activity. Climbing stairs feels harder. Carrying groceries requires a pause. A brisk walk leaves someone unexpectedly winded. Adults blame aging. They blame being out of shape. But breathlessness is not a fitness issue. It is an oxygen issue. This sign often appears months before iron deficiency is recognized. Brittle or spoon-shaped nails. Nails crack easily. They thin out. They curve upward like tiny spoons. A condition called coil coilin coilina coilinchia. People blame aging, dryness, hand washing, or nail polish, but nails are made of keratin, and keratin production depends on adequate oxygenation. When iron is low, nails show it. Restless legs or odd cravings like ice. restless leg syndrome, or RLS, and pica, especially craving ice, are strongly linked to iron deficiency. These symptoms feel quirky, quirky, not clinical, but these are among the clearest early indicators that iron stores are depleted. Why adults miss this? Why adults miss these signs? Iron deficiency thrives in the blind spots of modern life. We normalize exhaustion. Fatigue is expected, even even admired. People brag about how tired they are. We blame ourselves. Adults assume they are not sleeping well, not eating well, not managing stress well, instead of considering a psychological cause. Primary care is rushed. 12-minute 12-minute visits leave little room for slow burn symptoms. Without a CBC and a ferritin level, iron deficiency hides. Symptoms develop gradually. There is no dramatic turning point, just a slow erosion of vitality. Women's symptoms are often minimized. Fatigue, headaches, and mood changes are frequently dismissed as hormonal or emotional. Older adults attribute everything to aging, breathlessness, cold tolerance, paler, all quietly folded into one the narrative of getting older. The cultural story, why we ignore what hurts. Iron deficiency hides because adults are conditioned to minimize their own needs, to interpret symptoms as personal failings rather than psychological signals. We live in a society that praises people for powering through, that treats the rest as indulgence, that frames fatigue as weakness. This In this environment, iron deficiency thrives, not because it is invisible, but because we are taught not to look. The systematic story, why we keep missing it. Iron deficiency persists because our structures allow it to. Preventative labs like ferritin are inconsistently covered. Primary care visits are too short to catch slow burn symptoms. Nutrition counseling is soloed outside medical care. Public health messaging rarely includes anemia awareness. Workplace wellness programs treat fatigue as a productivity issue, not a health signal. These gaps disproportionately affect women of reproductive age, older adults, people with chronic disease, rural residents, low income workers, communities facing health literacy barriers. Iron deficiency is not a niche problem, it is a national one. The consequences of missing it. Iron deficiency is not benign. Left untreated, it contributes to cognitive impairment, worsening depression and anxiety, reduced work performance, increased fall risk, pregnancy complications, avoidable hospitalizations. The tragedy is that the solution is often straightforward once identified, but only if identified, the call to notice. If we want adults to thrive cognitively, emotionally, physically, we must stop telling people to push through symptoms that deserve attention. We must stop treating exhaustion as a personality trait. We must stop confusing a medical condition with a character flaw. The most humane act is noticing fatigue that doesn't make sense, noticing breathlessness that feels new, noticing nails that break, legs that twitch, cravings that appear out of nowhere, noticing the quiet ways the body asks for help. Iron deficiency is common. Iron deficiency is treatable. Iron deficiency is often missed. It is time we stop letting it. Okay, guys, that is your D for tonight. I will see after dinner if I can do a another show or not. For now, Gator Wellness. Take care, folks.